What happens when your health is determined before you are born? You can imagine two children are born on the same day. One grows up in a wealthy neighborhood and the other in poverty. One has access to great health. The other one struggles for basic medical care. The life expectancy of these two children could be 10 years apart. And this is mainly because of where you are born and the circumstances surrounding you. These we call them the social determinants of your health. I'm Dr. Joshua Nderitu, a family physician. In this video, we are going to look at the impact of social determinants of health on your health outcomes. We are going to look at the factors that are related to the society that affect your health. So, what are social determinants of health? These are conditions in which people are born, they grow, work, live, and also where you age. They include things like your income, include your education, the environment that you are in, and also where you work, and also how accessible you have to healthcare. And they are major drivers of health inequalities. We are talking about how accessible is healthcare to one individual compared to another, because you find that in the society, people who are well economically endowed, they have better access. They need healthcare most, sometimes least, but they are the ones that have very high access to it. While people who have grown up in poor conditions and they are economically deprived, even when they need healthcare, they completely do not have access to it. And this is why the government policies, the society, the community comes in, so that we try to bridge this gap of inequality, so that everybody has equal access to healthcare. Remember that access to healthcare is a right, and all of us should be able to get healthcare when we need it and at an affordable price. So what are some of the key social determinants of health? One is economic stability, your financial capacity. You have things like poverty, we have issues of job security, and also you have your income, how you get your money. Then we have education. Being educated, of course, improves your capacity to access healthcare. By the fact that you have educated, you have higher chances of getting a job, you have more know-how on taking care of your health in a better way. Then you have early childhood development and school quality, the type of school you go to, and also the environment where you have grown up. Then you have healthcare access. There are many things that determine one's access to healthcare. Of course, the first one is your economic capacity. Then the other one is insurance. If you have a medical cover, then you don't have to struggle very much. When you get ill, you just go to the healthcare, you get treated, and then your healthcare insurance pays for your health. Then availability of medical facilities. There are people who where they live, access to healthcare is so bad, and this you find that has implications on childhood illnesses, access to safe deliveries, and also antenatal care. And you find that people who have poor access to these healthcare facilities, they have poor outcomes, poor maternal, more maternal death, and poor morbidity, more childhood deaths are related to complications of childhood diseases. But it doesn't have to be like this, because if we just tweak our access issues and the issues of insurance, universal health coverage, everybody, regardless of his financial situation, should be in a position to access health care. And that's why universal health coverage is so critical, that our society is able to access health care. Then you have issues of neighborhood and the built-in environment. we talk about safe housing, and also this also comes with economic capacity, pollution, and also the transportation system, issues of road safety, and also other issues. Then we have social and community context. We have issues of discrimination, women having less access to health facilities when they need it due to their financial capacity, and also the social support systems not being able to access equitable employment as their male counterparts. And when there is this inequality, when they need some of the medical care, you hear of issues of women having issues of access to sanitary pads, very basic things, but they have a big impact. And this also has impact on reproductive health access for ladies. So how do these impact the health outcomes of individuals? Economic barriers. When you don't have the capacity, it could mean like you cannot get transport to the hospital. And this is what is the impact of this? Delayed care, because you did not get to the hospital on time. Out of this, then you get complications. So there is higher disease burden. You can see the situation. Then low education limits health literacy and preventive care. As I've said, if you are well educated, the chances are that you are likely to get more employed. You have more skills, even to get into the entrepreneurship and get better access to finances, and also you have more knowledge about preventive care. But these are things that if as a society we organize in a better way, we can be able to increase health literacy among all the people equally. Then poor health access results in unmanaged chronic conditions. I've talked about access to antenatal services and safe delivery services, care for chronic diseases. If you have diseases like diabetes, hypertension, you do not have somebody to do your blood pressure when you really need to have it done. Then this can delay and lead to complications. By the time you present to the healthcare, is because when you have a stroke. And I've seen many times that patients who get cardiovascular accidents like strokes, they have no previous access to healthcare. They have not had their blood pressure accessed, and that's why the issue of community health workers being able to have a particular given number of homes which you are in charge then helps that these individuals that are under your care, nobody should go without having his blood pressure checked, nobody should go without having his blood sugars checked, knowing their HIV status, access to antenatal care, because they have a community health worker who is attached to them, and the community health worker is able to attach them to a healthy facility. And when there is need for referral, then the referral process is streamlined. Then unsafe environments increase exposure to stress and violence. You have seen some of the low-income social setting. The crime rate is high. Access to clean water is poor. Sanitary facilities are poor. And if you can imagine people like who live in low socioeconomics there with poor housing facilities, then you have heard of outbreaks of diseases like cholera. Of course, these come up with the death of masses, and they are not very good stories. Then we have lack of social support, whereby this can lead to mental health because you do not have someone to share your problem with, and sometimes because of the poor literacy, in some of these low socioeconomic situations, mental health are not seen as real health issues, and this makes them to get ignored. So what is the cause of ignoring these social determinants of disease? One, higher rates of chronic diseases. And you find that societies where they have low economic status, they are catching up very fast on lifestyle diseases. Diabetes is rising, heart diseases are rising, cancer cases are rising, because we have adopted a Western style kind of dietary lifestyle, but our economic status is still not at par with these developed nations, and so we are hit harder by these lifestyle diseases. Then you have lower life expectancy in disadvantaged community, and this is obvious in our societies, especially after the HIV pandemic, then the life expectancy significantly dropped in some society. Then of course there is increased healthcare cost for individuals, the families, and even the healthcare system. When people come to the health facilities when they are very sick, it is costly to the patient, it is costly to the family, it is costly to the family, and it is costly to the health system. And so that's why we need to embrace preventive care. So what can be done to bridge these gaps on the social determinants of disease? One is to improve access to quality health care and education, and that's why education is a must, and it is key, and every child must be educated, and the government has a responsibility to make sure that individuals get educated to the highest level possible and make education accessible, so that as much as education is one of the things that bridges the gap of poverty in a very significant way. Of course, even after education, we have to think about giving employment to the young people. As we are struggling as a society now, we have so many young people who are jobless, and we need to get solution to these problems. Then addressing economic and housing inequalities. We need affordable housing and also economic empowerment of individuals. Then there's need to strengthen social and community support so that each person has an access to healthcare, has access to the social amenities, and they are brought to par. If sanitary facilities, toilets and the like, clean water, they should be available to all the citizens of this country. And that's why the big responsibility of the county government, especially looking to issues of sanitation, looking to issues of clean water provision, and also the drainage and waste management is very significant in the health of the people living in the counties. Then implement policies that tackle discrimination, every person having an equal access to the common good without discrimination because of your age or sex or your tribe or your sex or your financial status. All of us should be able to access the social amenities without being discriminated. So be the change that we want. So advocate for policies that reduce health inequalities, support community programs improving social conditions. We have a lot to do, especially to improve the environment where we live in and make it environmental friendly. Then it is important that we all get to be aware of what we can do as a society, because health is not just medical care, it is the overall health of an individual. And as I've said in one of my previous health talks, it is not just the absence of disease, but it is the overall health of an individual, mentally, spiritually, psychologically, and also physically. So together we can create a healthier and a fairer world. So let's join hands to make this a reality. If you like this content, please subscribe and also share within our circle so that together we can build stronger societies that are health conscious. And you can also share within the comments of this video what are some of the things that you are doing as a community to improve the health care of the community that you live in. What are some of the things that we can do to make where we live be a better place? Could it be issues of education? Could it be issues of waste disposal, access to clean water? All these things. Share your comments. Thank you for watching.